Hey there, amazing people. Welcome to Donut Dental. I'm Dr. Ganesh and I'm here to help you ace the CSCE OSCE exam. Let's get started. Dental anomalies and conditions. In the world of dentistry, it's not uncommon to encounter variations in tooth development and structure. These variations, known as dental anomalies, can range from minor cosmetic concerns to more significant functional issues. In this video, we'll explore some of the most common dental anomalies, shedding light on their unique characteristics and potential implications for oral health. Common dental anomalies. Concrescence. This occurs when two adjacent teeth become fused at the cementum of their roots. It can be caused by trauma or crowding during tooth development. While concrescence may not always cause problems, it can complicate dental procedures like extractions, potentially requiring surgical separation of the teeth. Mesiodens, the most prevalent type of supernumerary tooth, which is an extra tooth beyond the normal number. Mesiodens typically develops in the midline between the two maxillary central incisors. It can lead to various oral issues, including malocclusion, misalignment of teeth, food impaction, aesthetic concerns, and even the formation of cysts. Gemination. This anomaly involves the incomplete division of a single tooth germ, resulting in a tooth with a partially divided crown but a single root. The crown often exhibits a characteristic notched appearance. Gemination can affect any tooth but is most commonly seen in the anterior teeth. Fusion. The complete union of two adjacent tooth germs, leading to the formation of a single large tooth with two separate roots. Fusion can occur in both primary and permanent dentitions and may require restorative or orthodontic intervention to address aesthetic or functional concerns. Eruption cyst. A benign fluid-filled cyst that forms in the soft tissue around an erupting tooth. It typically appears as a bluish swelling and is usually painless. Eruption cysts often resolve on their own once the tooth emerges into the oral cavity. Diastema, a space or gap between two adjacent teeth. It can be a natural occurrence, particularly between the incisors and molars in some mammals. In humans, diastema can be congenital or caused by factors like an oversized labial frenum, thumb sucking, or the loss of posterior teeth. Supernumerary tooth. Any extra tooth beyond the normal number in the primary or permanent dentition. While Mesiodens is the most common, supernumerary teeth can develop anywhere in the mouth. They can impact tooth eruption, alignment, and overall oral health. Erosion. The gradual loss of tooth structure due to chemical wear, often caused by acids from gastric reflux in conditions like bulimia or acidic foods and beverages. Erosion typically affects the lingual surfaces of maxillary anterior teeth, leading to sensitivity, discoloration, and even changes in tooth shape. Dilaceration. An abnormal bend or curve in the root of a tooth, usually resulting from trauma during tooth development. Dilaceration can complicate dental procedures like extractions or root canals and may require specialized techniques or surgical intervention. Hypercementosis. The excessive buildup of cementum on the roots of teeth. It's often associated with trauma or inflammation and appears as a radiopaque white mass around the root or root on radiographs. While hypercementosis is usually asymptomatic, it can sometimes interfere with tooth extraction or endodontic treatment. Hence, in Dente and Invaginatus, a rare dental anomaly where the enamel folds inward, creating a tooth within a tooth. This condition increases the risk of dental caries, cavities, and infections, as bacteria can easily enter the invagination. It's most commonly seen in maxillary lateral incisors. Dense evaginatus, an extra cusp or bump on the occlusal surface of a tooth, often seen in mandibular premolars. This cusp may contain a pulp horn, increasing the risk of pulp exposure and sensitivity. If the cusp fractures, it can lead to pain and infection. Amelogenesis Imperfecta, a group of hereditary conditions characterized by abnormal enamel formation. Teeth may be discolored, pitted, or unusually small. Amelogenesis imperfecta can affect both primary and permanent teeth, leading to increased sensitivity, susceptibility to caries, and aesthetic concerns. Hypodontia, the congenital absence of one or more teeth. It can affect both primary and permanent dentitions. The severity of hypodontia varies, and treatment options may include orthodontic intervention, dental implants, or bridges to restore function and aesthetics. Ankylosis is the fusion of a tooth to the surrounding bone, preventing its eruption or orthodontic movement. Ankylosis is often associated with hypodontia, where a missing permanent tooth leads to the ankylosis of the corresponding primary tooth. It can cause complications like impaction or displacement of adjacent teeth. Conclusion. Dental anomalies are fascinating variations in tooth development and structure. By understanding these anomalies, dental professionals can provide accurate diagnosis and appropriate treatment plans, ensuring optimal oral health and function for their patients. In our next video, we'll delve into the world of oral conditions and diseases, further expanding your knowledge of the oral cavity and its potential challenges.